This is part 3 on the tissue lectures, and we left off talking about connective tissue proper. Connective tissue proper is connective tissue proper is associated with having many different cell types instead of just one primary cell type. The matrix contains all 3 of the extracellular fibers, reticular fibers, collagen fibers, and elastic fibers are the 3 types of protein fibers that you can find in connective tissue. And the ground substance is a syrupy consistency. Examples of connective tissue proper is the tissue under the skin, fatty tissue, and then tendons and ligaments, which are a denser connective tissue proper. The cells of connective tissue proper include fibroblasts, which are cells which produce the collagen and the elastic and the reticular fibers. They're always present in connective tissue proper, and they produce connective tissue fibers and ground substance. Macrophages are large phagocytic white blood cells. They are scattered throughout the matrix of connective tissue proper, and they phagocytize damaged cells or pathogens like bacteria that enter the tissue. They also release chemicals that signal to the immune system to come help fight this infection or problem. Fat cells called adipocytes or adipose cells are also found in connective tissue proper. Fat cells just store fat, store lipids. Mast cells are small mobile cells. That means they can move. They're found near blood vessels. Their cytoplasm is packed with granules, and they release histamine and heparin in response to injury or infection, and those chemicals will trigger the immune system. There are 3 basic types of protein fibers. Collagen fibers are the thickest and the strongest. Elastic fibers are for elasticity. And you find reticular fibers in organs like the liver and the spleen, organs which, if you cut through them, would be solid all the way through. They're very branching, and I always think about the reticular tissue as being kind of mushy, like liver. And here's the notes. Collagen fibers are for strength. They are the thickest of the protein fibers. Elastic fibers are elastic. They are able to return to their original length after stretching, so they're stretchy. We have elastic fibers and collagen fibers in our skin. And then reticular fibers are thin branching fibers, and they're the least common type. Ground substance fills spaces between the cells and surrounds the connective tissue fibers. In connective tissue proper, the ground substance is clear, colorless, and syrupy. So it's thick, but it's not a solid. It's more of a syrupy consistency. And it slows, what that does, it slows the movement of pathogens. Bacteria and other pathogens, like protozoans, are not able to move as fast through that syrupy material. Loose connective tissue proper is the first type. It's often referred to as the packing materials of the body, has more ground substance and fewer fibers. The 3 types are areolar connective tissue proper, which fills spaces between organs and provides cushioning. One place that you find areolar connective tissue is within the dermis, underneath the epidermis. Adipose connective tissue is fat. Fat tissue It stores fats or lipids. It insulates and protects organs. You find adipose connective tissue around the kidneys and the heart, underneath the skin and the breast. Reticular connective tissue forms the framework of soft organs like the lymph nodes, the spleen, the bone marrow, and I think I mentioned the liver. And these are pictures of the different tissues. This is areolar tissue, what it looks like under a microscope, and then a drawing of it. It contains all the different cells, fibroblasts, macrophages, mast cells, all the different cell types that we talked about. Adipose tissue contains adipocytes. Here's what it looks like under a microscope. And reticular tissue is found. Here's a picture of the liver right here. The fibers are branching, and it's found in soft organs. Now, we had loose connective tissue, which consisted of areolar, adipose, and reticular. The dense connective tissue is divided into dense irregular and dense regular connective tissue. Dense connective tissue is tougher, stronger, more durable, contains more fibers and less ground substance. And here's some places that we can find it. Tendons and ligaments are composed of dense connective tissue, dense regular connective tissue. So a tendon connects muscle to bone. And then we also have ligaments, which connect bone to bone. And these are both made of dense regular connective tissue. Dense irregular connective tissue is found in the dermis of the skin, the deep dermis of the skin. So loose connective tissue was found in the upper part of the dermis of the skin. So yeah, where it says here the areolar connective tissue, which is a loose connective tissue, if you look at the skin and if you say this outside part is the epidermis and then this is the dermis. Okay, so the upper part of the dermis is areolar connective tissue, and then this part, the lower part of the dermis or the deeper part of the dermis, is dense irregular connective tissue. All right, and then we move on to fluid connective tissue, which includes blood and lymph. The cell types found, and by the way, the matrix is plasma, and you do not have any protein fibers. There are no fibers in blood or lymph in fluid connective tissue. It's just the matrix, which is fluid, it's watery. So plasma is the matrix in blood. The cell types in blood are red blood cells, white blood cells, and platelets, which are fragments of cells that function in clotting. And then your supporting connective tissues include cartilage and bone. And their matrix contains many fibers and a thicker ground substance, more solid ground substance. Cartilage contains a very firm gel matrix with embedded fibers. The cells of cartilage are called chondrocytes. Chondro means cartilage and cyte means cell. And the chondrocytes all reside in small pockets called lacunae. Cartilage is avascular. So if you are asked why cartilage has a difficult, if you have damage to your cartilage tissue in your body, that it's not easily repaired, cartilage has limited repair ability due to the fact that it has no blood supply. The outside layer of cartilage is called perichondrium, which contains an outer fibrous layer and an inner cellular layer. The types of cartilage are hyaline, elastic, and fibrocartilage. And as you can see here, hyaline cartilage is the most common type, and it is found at the ends of long bones. If you've ever eaten a drumstick of a chicken, you see the cartilage at the end of the bone, of the part that you don't eat. There's cartilage that surrounds that end of that bone. Elastic cartilage is found in our ear, and fibrocartilage is very hard. Our intervertebral spinal disc are made of fibrocartilage. Hyaline, again, is the most common type of cartilage. It contains collagen fibers. It's located at the ends of bones that connect at synovial joints. So the ends of the bones that form your shoulder joint, your elbow joint, the joints within your fingers, your knee, your hip. Hyaline cartilage connects the ribs to the sternum or breastbone. Hyaline cartilage is found in the conducting passageways of the respiratory tract. The trachea is surrounded by rings of cartilage, and the nasal septum and the external nose is composed of hyaline cartilage. Elastic cartilage has collagen fibers and elastic fibers, so it is very flexible. The external ear, the epiglottis, which closes over your trachea and prevents food from going down into your trachea or your windpipe. And then your auditory tubes or your ear tubes are elastic cartilage. Fibrocartilage has very little ground substance. It's mostly packed with collagen fibers, so it's extremely durable and tough. It's good at absorbing shocks. It's located within knee joints in structures called the meniscus or menisci, and between the pubic bones, the pubic symphysis, which can actually stretch whenever a woman is going into labor, an intervertebral disc, which are the disc between the vertebrae. Bone is the second type of structural connective tissue, and bone tissue is also called osseous tissue. It contains a very small volume of ground substance. The matrix is composed of calcium compounds and collagen fibers. The calcium compounds make it strong, and the collagen fibers make it flexible. Bone, unlike cartilage, is highly vascularized. Highly vascularized. If you ever have a break in a bone, it's going to bleed. All right, bone organization. Bone cells are called osteocytes. Remember, cartilage cells were called chondrocytes. So bone cells are called osteocytes. Like cartilage cells, they reside in small pockets called lacunae. They're arranged around central canals within a matrix or within the matrix. They obtain nutrients through cytoplasmic extensions called canaliculi. And so let me blow this up. All right, so here is the central canal that contains blood vessels. Each one of these little structures, they almost look like eyes that are squinted. Each one of these structures are the osteocytes residing within their lacuna. And then the canaliculi are these little canals. They look like little veins. All right, the three types of connective tissues are connective tissue proper, supportive connective tissue, and fluid connective tissue. The connective tissue that contains primarily triglycerides is the adipose tissue. Lack of vitamin C in the diet interferes with the ability of fibroblasts to produce collagen. What effect might this interference have on connective tissue? Of course, that would make the connective tissue not as strong.